One of medicine's greatest kept secrets is that your body has an incredible capability to heal itself naturally. But you can't take advantage of that natural healing capacity if you don't know what you're up against. So here are the top 4 healthcare risks that I'm concerned about in my patients, and what you can do about each of them to help minimize the impact it has on robbing you of your healing potential. And if you don't know me, I'm Dr. Anthony Cave, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist here in San Francisco. Number 1 is loneliness. You heard back in 2023 that the United States announced a loneliness epidemic. This is not about calling people a special snowflake or saying everyone gets a trophy. This is not woo-woo. This is hard and legit medicine. This is what I see in my patients who are unconscious, connected to life support under anesthesia, in operating rooms like this. The effects on our mind and body when we are socially isolated affect our brain health, our cognition, memory, cardiovascular health, potentially even cancer risk, and chronic pain. These are some of the most heavy hitters and most expensive components to our healthcare system. Some studies even equate the effects of social isolation to 15 cigarettes a day on your body. Certainly, social media and other psychological disorders can contribute or be worsened by loneliness, and we'll talk about that at the end. But you have to remember that losing our connection with others is the first step to losing our connection with ourselves. And when we lose our connection with ourselves, we begin to lose access to our most powerful healing, that innate healing potential. Fortunately, it appears that the sweet spot is around 5 close friends whom we regularly interact with. That's what it takes to help tip the tide away from social isolation to being able to enjoy the benefits of social connectedness. Do you believe this loneliness epidemic is blown out of proportion and is too woo-wooey or crunchy granola? Let me know below what you think. Number 2 is cancer. Cancer is an incredible cause of morbidity, mortality, and costs in the United States and across the world. But even though we're doing a better job at treating cancer in our elderly patients, did you know that the rates of cancer are increasing in young patients, especially preventable forms of cancer in young patients? Colorectal cancer is now the number 1 cancer-related death in young men and number 2 in young women, just after breast cancer. Other cancers are also increasing: pancreatic cancer, liver cancer in women, oropharyngeal cancer, kidney cancer, melanomas, uterine cancers, and even cervical cancer. The good news is that many of these cancers are treatable if detected early enough, whether through pap smears, mammograms, colonoscopies. The problem is that guidelines are constantly changing for all of these life-saving preventive measures, but that's why you need to know the risks so that you can advocate for yourself with your doctor to make sure that you receive the right screening that you deserve to avoid these potentially catastrophic complications, especially in younger men and women these days. We don't yet understand why cancer is becoming so much more prevalent in younger men and women, but we absolutely need to make sure that we're screening. Did you know that more than 50% of cancer deaths are believed to be preventable through our lifestyle? Whether it's related to smoking, alcohol, sun exposure, social connectedness, physical exercise, dietary carcinogens, etc. There is so much you can do to help buck this trend, but you need to advocate for yourself with your doctor to make sure that you are getting the right treatment. In medicine, we say an ounce of prevention is worth a pound of treatment. And nowhere is this more true potentially than in cancer treatment. And if you're learning something new in this video, please hit that like button and share what you've learned with others to empower them. Also remember that you can subscribe to keep up with all these videos and my live streams, and you can join our exclusive access group where you can join our private live Zooms every month so you can ask more personalized one-on-one questions. And I practice medicine holistically in San Francisco, whether through ketamine or stellate ganglion blocks or NAD therapy, to help address the root causes of so many of these preventable conditions that are becoming increasingly burdensome on my patients and across the United States. Let's move on to number 3. Number 3 is dementia. Worldwide, dementia is increasing. It's nearly doubling every 20 years. That's a huge explosion, especially for parts of the world that aren't prepared to deal with end-stage dementia. In the United States, dementia rates seem to be decreasing, but there is concern for early onset dementia, and there are things that we can now do to help minimize our risk of developing early onset dementia, meaning dementia that develops in patients under the age of 65. I recently did a video on Chris Hemsworth, who is at a very high genetic risk for developing early onset dementia, and what he's doing with all of our available scientific knowledge to reduce his risk. In that video, I talk about the strategies around vitamin D supplementation if needed, alcohol use, diabetes, cardiovascular risk factors, and the importance of hearing aids, believe it or not. The health burden is enormous when we lose our ability to take care of ourselves, and the financial burden is also huge. Did you know that patients lose roughly 60% of their net worth, and their hospital bills nearly double in the first 8 years after receiving their diagnosis? Once again, an ounce of prevention is worth a pound of treatment for neurodegenerative disorders like dementia. And you absolutely deserve to advocate for yourself in this new year to help optimize your brain health. And number 4 is addiction. You've probably heard all over the news about the opioid epidemic and the incredibly high rates of illicit drug use across the United States and the world. More than 1/3 of adults in the United States have an illicit drug use disorder. And some of them aren't even chemicals. Look at social media, for example, and the undeniable effect it has on our mental health, not only worsening social connection that we talked about in number 1, but also its increasingly large impact on the developing brain in our children. The rates of dual diagnosis, or individuals that have both a substance use disorder, maybe from an addiction, and other mental health conditions, is absolutely enormous. And the cost is staggering at $740 billion in the United States. It's unclear what's going to happen at the political level around certain social media platforms, but you need to know to advocate for yourself and for your loved ones. Speak up when you find the trends of addiction becoming more apparent. And remember that addiction is not so much about the substance at the end of the day as much as what the individual is searching for that the addiction substance is helping to temporarily relieve. And we need to advocate for our loved ones and for ourselves to fill those holes, to address the root cause of addictions, whether it's to chemicals or to shopping on Amazon, slot machines, or even social media. With the right support and by addressing the root cause, we have the ability to improve our social connection with others, which addresses number 1, 2, and 3 earlier in this video. And lastly, I'll just end by mentioning that the cost of healthcare, especially in the United States, is absolutely outrageous and is failing my patients. Healthcare expenditure is increasing faster than inflation in some categories, whether through neurodegenerative disease or cancer, psychiatric disorders, or addiction. Federal spending on Medicare is ballooning. And if we don't advocate for ourselves, if we don't recognize just how much power we have over our own health, how our body is designed to heal itself, when supported properly, we run the risk of losing all of our financial and professional gains. More than half of individuals who file for bankruptcy in the United States cite healthcare costs as one of the reasons for their bankruptcy. How can we expect to be healthy if we're living in financial ruin? We need to heal ourselves holistically, looking at ourselves as a human being and not just as human doing. You have more power over your health than you've probably ever been told. Which of these 4 risks are you most concerned about this year? Let me know below, and never underestimate just how much power you have over your health.